you. It's great to be here. I'm Ida Sim. I'm the co-founder of OpenM Health, which is a nonprofit organization building an open platform for integrating digital health data. I'm also a primary care physician at UCSF. So I've lost count of the tens of thousands of health apps and devices out there that are helping us to track and manage our health. And ignore the sound over, we'll have that off in a little bit. Now, many companies like Apple and Samsung and many others, of course, know that there's great value in bringing digital data together for smarter sense making, and that's going to give us valuable insights into our personal health. And that's a great opportunity, but actually there's an even bigger opportunity. Over 75% of healthcare costs, yeah, let's mute him. Over 75% of healthcare costs are from chronic diseases, from high blood pressure, from obesity. We have Mike McConnell on, so great, thanks. And over half of Americans have at least one chronic disease. So if digital health data is going to have an impact on healthcare, it's going to have to address the clinical care situation. And we're going to have to integrate many different types of data together to give personalized clinical insights. And that's insights for patients and doctors to use together to both manage and prevent chronic disease. Now, sense making for clinical use is going to require a much closer attention to data, to workflow, and to the joint doctor-patient user experience than just health data for individual consumer use. So the question of the day is, how can digital health data be usable in a clinical practice in a meaningful, effective way? So before getting to treatment, let's talk a little bit about diagnosis. And for most of you, this is going to be pretty old hat. So the first thing is there's no easy way to share data. Many of my patients bring in a notebook of blood pressure readings or glucose readings, and sometimes it's meticulous data, and sometimes it's a mess. And of course, you're thinking, there's an app for that. That's true. But frankly, as a doctor, I don't have the time, the interest, nor the patience to keep up with all those apps. It's hard for me to know which ones to trust. And within a short visit time, I don't have the time to go to different websites of all the different apps that struggle with their data displays. It's just way too much work. It's just not going to work. Now, on the patient side, tracking is actually pretty hard and onerous, too. And with both patients and doctors getting not a whole heck of a lot of value out of the data, there's often not the cupcake at the end. So OpenM Health is working to solve these issues. We're working to build the road to bring digital health data into the heart of clinical care today. Here are the 3 key points about our approach. The first is that we need to think about digital health data just like any other data. It's not anything special. Just like lab data, just like CT scan data, it needs to come back into a workflow in a way that makes sense to me. We need to use that data collaboratively and with purpose. So patients and doctors together need to decide what data we want to order, why we order that, and what we're going to do with that data, and not just track whatever the latest hot startup is offering, right? For doctors, it's about the data, not about the apps, okay? Now, that data needs to come back to patients in a ways that they can use, and it needs to come back to me as a clinician in a way that's just like any other data that I use clinically. Now, imagine if I order a CT scan and I need to think, okay, so what's the latest, best machine on the market? And I have to decide what the scanning protocol is. And then when the data comes back, I need to go to a separate website and log in. And that's just not going to work. But really, that's what's being asked of us for consumer health apps today, and it's just not going to work. So again, it's about the data, not about the apps for us. And the data, of course, has to come back to us in a way that supports a stronger doctor-patient relationship, not in a way that burdens us. So I'm happy to introduce to you today a sneak preview of Link, which is an OpenM Health product initiative that solves for these problems and brings data, digital health data into the clinical care process. I'm going to be introducing this using a pretty typical case study of hypertension, although Link can be useful for any other clinical condition as well. We will be deploying Link, piloting it in Stanford Preventive Cardiology this fall, and Dr. Mike McConnell is on the line with us. He's on a Google Hangout, and he'll be with us later on in our talk here. So So let's start off imagining Sean. He's 44. He works hard. He's on the road a lot in sales. He tends not to eat very well. He loves spending time with his family, grilling and go-karting, and exercise just doesn't fit in his routine very much. He came in to see me back in June, and his blood pressure is high. It's 150, in the low 150s over the low 90s, which is over the threshold of 140 over 90, which buys him a formal diagnosis of hypertension. This also means that he's at increased risk for heart disease and stroke, and that really worries him because his dad died of a heart attack in his early 50s. Now, when somebody has a blood pressure over 140 over 90, the question automatically comes up, it's time to start medication. And like most of us, Sean doesn't want to start a medication. So we talk about ways that he can reduce his blood pressure without meds. And that's exercising more and eating a little bit better. So we talk about that, and we decide to give him a chance and see how much he can lower his blood pressure just through lifestyle changes. So a couple months has passed, it's now June, Sean comes back. And like most of my patients, he wasn't all that successful, right? Didn't exercise that much, joined a gym, didn't really go. It was really hard to change his diet. It's just really, really hard. And his blood pressure is still high. It's still over 140 over 90, and so we have to start meds. Let's say benazepril 10 milligrams, which is a pretty low dose. So now our joint task is to manage his blood pressure through lifestyle changes and as low a dose of medicine as possible. And it would be really useful for both of us if we knew how he was responding to his medications. So this is where Link comes in. Link is a product that allows me and Sean to create a tracking plan around his blood pressure and his physical activity. So we decide with Sean that he's going to get a blood pressure cuff, right? And he's going to check his blood pressure once a day in the morning before he takes his benazepril. And he's going to do so for 2 months until the next time that we see each other in person. Now, I know that with blood pressure medicines, by about 3 weeks, I should clearly have a sense of whether his blood pressure medicines are working. And if his blood pressure at that time is still over 140 over 90, I will increase the dose to 20 milligrams a day, okay? So what I do then is I ask Link to notify me if his average weekly blood pressure is over 140 over 90 about 3 weeks from now, okay? And I also set some bounds for emergency alerts if his blood pressure should go way high, which I think is really unlikely. Now, Sean wants to minimize his medication use, and he's now really motivated to improve his activity. It turns out that his employer has given him a coupon for a Fitbit, and so we say, yeah, that might be interesting to track his activity levels, right? Now, the American Heart Association recommends 150 minutes a week of moderate intensity exercise. So we discuss what that means and what it takes to get to 150 minutes a week. That's actually really hard. And he says, no way, no way. We decide that 80 maybe is a more reasonable goal, so we set that as a goal. He also wants to track weight. That's okay with me. We don't set a goal for that. We just track it for informational purposes. And I know that the heart rate is also captured automatically with a lot of blood pressure cuffs, so we track that too, okay? So now I click send, and what that does is it saves the tracking plan and it sends it to Sean. And voila, as a doc, I am done, okay? I'm done. All I need to know is that I've ordered data that's reasonably accurate and that it's gonna come back to me in a timely, useful way. I am so glad I didn't have to be up on the latest blood pressure cuff, the latest activity monitor, okay? I'm done, okay? So far, so good for me. This is what I do when I order a CT scan or a lab test, right? What about Sean? So Sean gets an email invitation to download the Link app, which he does on his phone, and he accepts the invitation. And the Link app also helps him to give some advice about devices. And so he chooses the Withings blood pressure cuff, the Fitbit, and also he kind of goes on a spending spree and buys the ARIA scale too. So he hooks and connects all that up, okay? Now, of course, that's the easy part, buying gadgets. It's much harder, of course, to track every day. So Link helps patients with strategies for daily tracking. He gets little cards like this in the mail to help him remember to track. And we know that for many patients, tracking is not something that they're used to. and that we are really using a lot of design principles of our designer, Katie McCurdy, to understand how to help patients track every day and to give them strategies to make that be successful. And of course, it's also important that doctors and patients together decide what to track, for how long, and why. That's really part of the motivational support for tracking as well. So when Sean tracks, the data comes back to his own app. If I wanted to, I can peek at the data through my own clinician view, but I'm unlikely to do that. I wait, and 3 weeks later, lo and behold, I get a message in my inbox, which is where I do all my clinical work. So just like any other data, it comes back to me, and it tells me that Sean's blood pressure is indeed still high. It's still over 140 over 90. So I see details, I click on it, I go to link, and I see that his blood pressure is still over the 140 over 90 threshold. And I can see that the daily blood pressures, and I see that there are times when his blood pressure is over the threshold. The systolic, which is the higher number, is above range, so that's the orange parts. But I notice that he's sort of in fits and starts, right? Sometimes he's well controlled and sometimes he's not. And that brings to mind that, well, maybe he's just not, he's not taking his medication daily on a regular basis. That might be something. So I call him up and I talk to him, and we review the data together, him on his device and mine on my own device, and he admits, yeah, he's been kind of spotty. A friend told him that, you can get hooked on blood pressure medicines, and once you start, you can't get off them. I hear that a lot from my patients. So we talk about that. He's reassured, and I decide not to increase his dose, but to encourage his adherence and to continue tracking. Okay? So I also informed Link then to notify me again 3 weeks from now if his average blood pressure exceeds 140 over 90. Now, what would this, let's take a pause in the Sean story here and see what is my daily practice like without Sean. What would really have happened? Well, I would have started Sean on 10 milligrams of lisinopril. 3 weeks later, he would come back, right, park, which is hard, see the nurse. I would get a note in my inbox, and then my nurse would say, Sean's back, his blood pressure's over 140 over, I get one reading, right? I would get a note that he doesn't have any side effects and his adherence is pretty good, right? Because practically everyone says their adherence is pretty good. I would. And I probably honestly would have increased his dose. He'd be up to 20, okay? And I would think we did a good job, okay? So I would have missed a deeper understanding of what's going on. I would have missed the opportunity to have a discussion with Sean, okay? And both him and the nurse would have had an extra visit, and all of that would not have to happen with Link, okay? So going back to the Link story then, I wait 3 weeks, and it's August 2nd now, and I actually haven't heard anything, and he shows up. So now it's 2 months after starting benazepril, and it's now about 5 weeks after our initial phone call. We reviewed the data, and lo and behold, his blood pressure is now under goal. I see that there's more adherence, we think, right? Because there's a little bit of fluctuation, but overall the trend is pretty good. We also see that he's been more active. Didn't really start off active, but really picked up in the last couple of weeks, right? Maybe even a little bit of weight loss there too. So this gives us some more data to have a deeper discussion. What worked, what didn't work. And we talk about, 80 minutes is really just not feasible. So we talk about, and he says, maybe I can do 50 minutes. And that's a reasonable goal. And that might help us eventually get to 150 minutes. Okay? So this has been very useful. And Sean admits that having this kind of data and having that phone call really showed that I was holding him accountable, and he found that motivating and encouraging indeed. Okay? So overall, Link gave us a far more positive, personalized experience. From the patient's point of view, he's got positive reinforcement for making health behavior changes, and overall, he had a healthier outcome, right? He's exercising more, he's only on lisinopril 10 milligrams, his blood pressure's controlled. For my part, I was able to titrate a medication more quickly. Sometimes this takes months because the patient forgets to come back in 3 weeks. Overall, there's less utilization, right, with fewer clinic visits. Hopefully lower costs because there's more blood pressure control earlier. And more importantly, I think we build a stronger doctor-patient relationship, and that's going to have dividends in the future. That is very important. So we'll be deploying Link in Stanford with Dr. McConnell.
Great. Thanks, everybody. Thanks, Ida, and thanks to Larry and the Medicine X team for giving us a chance to talk about the OpenML platform and Link today. As Ida mentioned, I'm a cardiologist here at Stanford, working on both prevention and innovation in cardiovascular health. I'm really very excited about the potential for Link and the Open Health platform to bring mobile and digital data into our clinical practice. As clinicians, as you heard from Ida describing, we really struggle with how to integrate all these data into the care of our patients without disrupting our very busy clinical workflow. With Link, easy to view and review this mobile health data with our patients without having to worry about the specific app or device that it might be coming from. This is really critical towards helping doctors and nurses use these mobile health data towards our main goal, which is helping our patients stay healthy. Staying active, a healthy diet, blood pressure control, all of these are really fundamental to our effort. Forward to testing Link for our enhanced. Thank you very much.
Thanks. So you probably got the gist of that. We are super excited to be partnering with Mike here at Stanford. You know, I think the issue though is that while we're piloting Link in hypertension, it's really a general approach. Anytime we need patient-generated data between clinic visits, Link is an approach that's usable. So for example, tracking asthma inhaler use and wheezing symptoms. Is the kid's asthma worse at school, maybe at grandma's house? Tracking pain and mobility after hip surgery to make sure someone's on the right track for recovery. Tracking pain and response to pain medications for lowest effective medication dose. Tracking sleep to see if lack of sleep is a trigger for migraines. So all of these use cases use some of the data that is also useful in Sean's case, but also, of course, other types of data. So we are expanding our data sources, where these are some of the data sources that are incorporated into Link right now, but we are including other data sources, obviously, including HealthKit coming up. And that's going to bring it, make it more flexible for patients to, bring their own apps, right? To use whatever apps and devices they might want to fulfill their tracking plan. So this is going to allow us to support more use cases. And what's really exciting is that the data sources and the data integration that we have underlying Link will be available for free in an open source platform, the OpenM Health platform for developers. As I said at the outset, OpenM Health is a nonprofit organization. Our fundamental goal is to increase the use of digital health data and bring clinical meaning to digital health. And we are not going to do that alone. We need to do that together, all of us in this room, in this conference, and then beyond. And the OpenM Health platform is our main offering to developers so that we can do this together. Under the hood, the platform has open source data schemas to give third-party data more clinical meaning. There's open source API wrappers to common devices. And it also has some basic processing modules to get developers started. So if you're a developer, the OpenM Health platform is going to be a one-stop toolkit that's going to help you build products like Link. Link is built on it, but there are other products you can build on it, of course, to build your own insanely great products. So if you have other data sources that you want to include, data streams that you want to make sense of, let us know. If you're not a developer, but you're a patient or a clinician, we need you just as much. We'll be rolling out Link with other clinical partners, always looking for clinicians, patients, doctors, nurses, other healthcare providers to give us input. So please link up with us, join our community. Thank you.